Okay, so I'm Dr. Bob DiGiorgio, and I've been a practicing dentist here in Colorado since 1980. Graduated from Georgetown University in 1978, and presently I practice in Parker, but I've had practices in different parts of the city over the years. I'm looking to get back to Denver in some capacity, so I searched around for an opportunity and I found Jankee and her hygiene clinic, and she's offered me the opportunity to get back to Denver. So I'm going to be here initially 2 days a week, Tuesdays and Fridays, and I plan to interact with Jankee the way I do with my hygienist presently in terms of Jankee doing exams and x-rays, and then I follow up with my own exam and then be available for the patients to do their dentistry. Um, don't really like doing hygiene myself. Some dentists like that, but that's not my strong suit. I'd prefer doing the clinical fillings, crowns, root canals, etc. And so that's a good fit with Jankee because she can't do those things. So I think we'll fit well together. You know, I've always supported the hygienists. When I first got to Colorado, there was a very big controversy about hygienists providing local anesthetic. Now we sort of take that for granted. At that time, probably in the early 80s, the dental profession was against the hygienists giving anesthetic, and I really supported it because I thought it would be a great value to me in my practice to be able to have somebody provide that service. So I was happy to support that. And in fact, today, when I interview a hygienist, if he or she cannot give local anesthetic, really not somebody that I'm very comfortable hiring. So um, I supported the hygienist with that. When the question of independent practice came around, and I don't remember exactly when that was, but I'm pretty sure it's been around Colorado for like 20 years. So it was a little off-putting at first when uh, the legislature passed that hygienists could practice independently, but the reality of independent hygiene practice in Colorado is different than what was originally proposed, in that there's not as many hygienists that take advantage of it. And I think it's the rare hygienist that can really make it successful. And I believe Jankee is one of those people because she really has a lot of energy, a lot of enthusiasm, and I think it really takes that to make a practice fly. And the fact that she's willing to have a dentist be with her speaks a lot about her values in dentistry and what services she wants to provide for her patients. Well, you know, dentistry, we've been faced with so many new paradigms, and I've been practicing for 38 years, and there's been so many new things that have come along in those years. Independent hygiene, um, hygienists giving local anesthetic, the advent of the big box clinics that have taken a toll on private practice. So I think it's just a different practice model. And I think it's an alternative to traditional practice where the dentist employs all the ancillary personnel like the hygienists and the assistants and maybe other dentists. So this is just a different model, and maybe we're on the forefront of something. I like to think that.